just going to record this one because there's people who have signed up who can't join. So if you have signed up tonight, you'll get an email with a link to the recording of tonight's presentation as well. And that way you can replay it whenever you like. So that should be helpful. And yeah, so other than that, I think we'll get started. So I can see a few people that have their microphones not on mute. So if you could just pop your microphone on mute, that would be great, just so we don't have any background noise. Alrighty. So I'd just like to welcome all of you to Let's Talk Endometriosis. So thank you so much for joining me this evening. If you signed up through one of the other people on the panel and you're not quite sure who I'm Isabella. I'm the creator and I am the creator of Let's Talk Period, and I run the podcast and all the bits and pieces that you see behind the scenes. So I'm the one behind all of that. So that's who I am. Let's Talk Period is a podcast, but also a community for people who are living with endo, adeno, or PCOS, as well as other chronic conditions, just to give real information, raw, reputable information, raw stories, and basically just smash stigmas and taboos. So basically making the uncomfortable comfortable and talking about anything that we shouldn't necessarily be talking about in quotation marks. So firstly, I've already said it to everyone who's joined, but just making sure your camera and microphone are off throughout the presentation tonight, just so the panelists are able to talk easily and the connection's not interrupted, because we're on a Zoom meeting and not on a webinar. That just gives ease of access to that. And then also, if you have any questions this evening, if you could just pop them into the chat, and we will have time for questions at the end. So if you have any questions, just put them straight into the chat, and we'll have some time at the end to answer any questions. Okay. Other than that, we'll get into it, and we'll start with our acknowledgement of country. So I'd like to acknowledge the Gyrdle and Jarowaha peoples on the land of which this event is hosted from. So I'm based in Queensland, and that is on the Gyrdle and Jarowaha people's land. I recognise their continued connection to the land, and I pay my respects to the elders past, present and emerging, as well as extending that respect to the First Nations peoples here today. I acknowledge that this land was never ceded sovereignty and was, is and always will be Aboriginal people's land. So without further ado, here are our panelists this evening. So we have Dr. Mikayla Couch, an obstetrician and gynaecologist. We have got Sarah Anderson, a pelvic physiotherapist. We've got Agon, who's an LGBTQIA advocate and suspected endometriosis sufferer. And then we've also got Derval Ormond, who is the Friendo App founder. So I will let them all introduce themselves. So I will turn off the screen sharing and I will pass it over to you, Mikayla. Can you give us a little intro about you?
Perfect. My name's Mikayla and I'm a doctor in Lismore in New South Wales. I'm an obstetric and gynecology registrar and I absolutely love my job. I run an Instagram page called Dr. Aboriginal Woman, where I try and talk about Indigenous health, women's health, and try and break down stigmas. And sorry, I'm just getting myself coming back and it sounds really funny. Anyway, I try and break down stigma and talk about health promotion and health education, because I feel like our health is so important to us and we put it to the side most of the time because we're just so busy and we have so much going on, but it's obviously the most important thing in our life. And I love my job. I get to work with women every day and really talk about their bodies and hopefully empower them to take control of their health and love their bodies, their vaginas and all of their parts that make them who they are, because it's really important.
Wonderful. Thank you so much for sharing. I'll pass it over to you now, Sarah, if you could give us a little intro about who you are and what you do.
Yeah, of course. Well, thank you very much for having me. Like you said, Isabella, my name's Sarah and I am a women's health physio based on the Gold Coast. So I've been doing pelvic floor physio for the past must be about 4.5 to 5 years now. And I pretty much started in pelvic health when I graduated. I had a placement at one of the local private hospitals on the Gold Coast and learned all about obstetrics and gynecological operations, and I guess just different things about prolapse and incontinence and pelvic pain and all these things that I had knew nothing about. And then I guess getting into women's health, I found out so many of our women are actually suffering with endo and adeno and PCOS, and there's just nothing really out there. So that's where I found my passion in pelvic floor physio, and I couldn't do general physio anymore. There's too much reward and satisfaction out of helping my patients who have gone through, chronic pain for such a long time, and just being a bit of a support person. So it's very rewarding, and I absolutely love it.
That's so amazing to hear, and I think that reward would just be so special.
Yeah, for sure.
Oh, Aegon, I would love to hear from you now. Can you tell everyone all about you and your journey, I guess, so to speak?
Yeah, so my name is Aegon, or you're also welcome to call me Egg. So I am a queer and trans person who very likely has endometriosis. I'm still in the process of a diagnosis, which has led me to understand the barriers that are there in getting that diagnosis and getting that treatment. I have grown up in the disabled community most of my life. I have an older disabled brother, but I didn't realize that I would come to know what it is like to be disabled myself until my early 20s. So I'm actually really passionate now about making changes in these communities, especially in terms of the endo community, about inclusive language and really talking about how this is a illness that affects everyone. It's not just women focused. That's really important to me as someone who is trans and has faced many barriers because of who I am. But otherwise, I live in Canberra. I'm a part-time student. That's essentially it, really.
That's you. Wonderful. Thank you so much for sharing. And you bring up some incredibly important points that I cannot wait to dive into deeper in a little bit. And then last on the panel tonight, we've got Devil. Devil, I'd love to hear all about you. If you could share a little bit about yourself.
Hi, and thanks for having me. I think I'm the only one on the panel outside Australia. So hello from really sunny London, actually, today. My name is Derval Ormond, and as Isabella mentioned, I developed Friendo App, and really out of my own journey, 18-year diagnosis journey, searching for a diagnosis and being misdiagnosed and feeling so isolated along that journey. And I guess I created what I wished I'd had for that whole time. And really what it does, it screens for it. So it helps those who have suspected symptoms, and then it helps you with your chronic illness along the way in terms of tracking. It's a specific endo tracker, and it has a community as well. So what I'm hoping to do is, I guess, focus on grassroots as much as possible, and really we try and also take there is, I see, a massive challenge around misgendering as well. So we try to take as neutral a position within our app and across the board. Because I think dealing with endometriosis alone is a massive psychological challenge. And then if you have additional challenges as well, when you feel misgendered and by doctors, which is just a chronic issue here in the UK for sure. So our mission is really to screen as many schoolgirls and third level students as possible, and raise awareness, like I think everyone here is doing. So I'm really happy to be part of this, and happy and excited to jump into the discussion.
Yeah, I'm so thankful to all of you for giving up your time this evening and today, because it's 9 o'clock over in the UK. I think, I'm not sure if all of you have listened to the podcast previously, but if you haven't, the way I start each podcast episode is by asking what you've done to nourish your body today. So I thought it would be only fitting to start the panel interview off in a positive way as well and chatting about that. So we might flip it back to you, Mikayla, and get you to start with that one as well.
So I had a really busy day of like driving 4 hours here and there and everywhere, doing all this junk. So I spent the last few hours just chilling on the couch and nourished my body with some Netflix. I just started watching Pieces of Her, which is like, if anyone started seeing it, oh, it's so addictive. Oh. So my body feels really replenished, actually. I feel great now.
Oh, that's so good to hear. Sarah, what have you gotten up to nourish yourself today?
Look, I feel like mine is such a typical physio answer, and I started off my day bright and early with a reformer Pilates class. So that always makes me feel better. If I get up and roll out of bed and go straight to work, I just don't feel quite as energized. So that definitely always helps me kickstart my day for sure.
Oh, for sure. That's such a good answer and definitely very physio. Egg, what have you gotten up to?
So I've actually been recovering from a very severe case of tonsillitis. And honestly, all I really did today was nap. So I didn't really get out of my bed very much. And it was actually quite refreshing. Usually a whole day of napping will make me feel worse, but I actually feel so much better. So hopefully I'm at the end of this case.
Oh, I really hope so. And rest is productive. We need to remind ourselves of that. And last but not least, Darvel, what have you done? I know you've got COVID at the moment, so how have you nourished yourself today?
I have not had much of the day, but so far, I just made some porridge and had loads of fresh juice, and I have COVID, and I'm feeling the pain definitely around my pelvis and my endo. And so yesterday really took it easy. And I think everyone is saying, rest is just so crucial in kind of listening to your body. And I think for me, that's the key to recovering from anything. So I didn't jump out of bed this morning. I'm not gonna lie.
That is fair enough. While I've got you, I might throw this question to you first. And it's all about managing our health when we are managing a chronic health condition or not. There are therapies, items, people, strategies, and just things that help us to manage. Is there something that you'd recommend to everybody tonight that they include when it comes to managing their health?
For sure. I think it took me quite a long time I have stage 4 endometriosis. It's quite complicated. It's, caused a lot of pain, but I think above all what it caused was a lot of emotional distress, and I kind of removed myself a lot in the early days. And I think when you don't know what it is, you tend to remove yourself because you're embarrassed or you feel like, what's going on with my body? And then you naturally remove yourself. And then, so you almost lose this trust in your body. And, but I certainly think as time has gone on and, I was diagnosed, and then I learned ways to manage it. And I think the biggest thing in managing my health overall is actually just not to feel guilty about doing whatever I need to get through a flare-up or to feel better and stronger. And if that is, there were years of just feeling guilty about bailing on events, or, when you just know what you need is to get into bed and to, or to do whatever it is. And so for me, I think it's more psychological. It's kind of finding the right environment for me to be able to rest. And I think, having the right people around, and that calmness that doesn't kind of infuse more stress, which then brings on more inflammation. So that is kind of the first thing I would say, is feel empowered to make the decision to do what you need above everything else where possible, you know. And I feel certainly acupuncture, I went for years trying to find a really good acupuncturist, and I found a good one, and that really helps with my symptoms at the time, with pain. Swimming, I haven't been swimming in quite a while, but yeah, I would say for me it's mostly about knowing what's right and what's wrong in my environment around, and actually just feeling strong enough to make a decision to say that's not okay for me right now and step back from it.
Yeah, completely. Thank you. And I think that mental aspect is huge, and one that we can never underestimate, because it is such a huge impact. And I think everyone in this meeting could be touched by that and have a similar experience. So yeah, thank you. Egg, have you got something that you'd recommend to everybody include when it comes to managing their health?
I think my biggest one is finding your community and your people. And it doesn't have to be this whole endo community or this whole chronic illness community. It can be as small as 3 really close people, but find your people who are going to advocate for you in those times that it's really hard. I know, especially, I have a lot of my support network who are willing to do the emotional labor to advocate on my behalf, especially as a trans person. They're willing to advocate for the correct name use, the correct pronouns, and really, you know, step toe to toe with these doctors, with these professionals, and be like, you need to be using better language. You need to be acknowledging who this person is and not just what they've turned up to the ED or turned up to your office for. So finding people who are going to support you, who are willing to help advocate for you, I think that's really important. And knowing that it doesn't have to be the biggest community, it can just be a select few. That would be probably what I would say.
Oh, definitely. And I think having those few people to lean on, I guess it comes back to that quality over quantity for sure. Sarah, what would you recommend?
I think a big one for me is always education with whatever it might be, whether it's health or whether it's personal or whichever, you know, you're going through. I think educating yourself about what you're going through, you know, what help is there out there, but also looking at the right education as well. Because as we all know, with these chronic conditions, Dr. Google is a fantastic thing, you know, to make your condition worse. So I think looking at the right resources and seeing the right people and getting, like Aegon said, getting people on your side, getting, you know, a great GP to listen to and actually sit there and listen, spend that extra 5 minutes with you, can make the world of difference to our patients. And also, you know, whether it's a good psychologist or a good physio or whoever it may be, I think educating yourself will help you, you know, understand how your body might react and what you could do to your body as well, and how you can help yourself as well. So I think it's always with my clients that education's always been number one, and that's what I spend the majority of my time doing, is just purely educating and talking, because I think a lot of the time my patients don't feel heard. And so I think talking about what you're feeling is a massive, can make a massive difference to help you get through that day even, you know. So yeah.
Oh, definitely. I could not agree more. And I think education is so empowering, and, you know, knowledge is power, and having that information and knowing that it's reputable, it can just do so much for you. So yeah, thank you for that suggestion. Mikayla, what would you recommend to everybody?
Mine's just really simple. I think just being really gentle on yourself, because it's like going to be the first time that you're going through this day, these symptoms, how you're feeling, and really just being kind to yourself and just not getting too much in your head and not making it, you know, just this terrible experience, even though it is terrible. Like I cannot imagine living with endo. I have PCOS, so I have like all of those worries in my head and fertility worries. So I just try and be really kind to myself and just don't make it worse, basically.
Oh, for sure. And I think something that like goes so nicely with that and being kind to yourself is thinking like, would I say that to my best friend? And if the answer's no, should I really be saying that to myself?
Definitely.
Yeah.
I agree entirely.
I think we'll dive in with you first, Dr. Mikayla. All about endo, obviously, as tonight's panel is, we know that there can be a diagnostic delay between 7 to 12 years, even with the increasing awareness and knowledge about endo. Just making sure our microphones are on mute, everybody. Sorry. Okay. Alrighty. So even with that even with the increasing awareness and education and such, there's still that 7 to 12 year delay. Why do you think there is still this delay to diagnosis?
It's crazy to think in today's day and world, that today's day and age, that we still have that delay, because we're obviously at the most technically advanced that we've ever been. We have obviously the best healthcare system that we have ever had. And it's in Australia, luckily, free healthcare. There's still so many barriers to getting to see a doctor, for one, seeing a GP, especially with COVID and at the moment where I'm living, the floods, obviously. So just environmental factors are impacting on the fact that it's even hard for a new patient to see a GP. Then for a referral to a healthcare system can take 18 months at my service. And then with you having investigations, that can be another 6 months. And then once you've had all of that done, if you're waiting for a diagnostic lap, that can be another year or two. So that all added up can be a year to two in itself, let alone, you know, what you're going through in terms of your symptoms. You're probably not going to go to the GP unless you've had a few months of symptoms to start with. So it's going to be a long process. I think there's still a really large role for education in terms of GPs, in terms of all GPs, females, males, anyone who is a GP should be well versed in endometriosis as a possible diagnosis for their patients. And I think there's still a long way to go, because they're the first line doctors who will see these patients, and also who will then refer if they think that it's necessary. So I think a lot of patients will still have had the experience of seeing the GP once, twice, 3 times, 4 times, and then the GP saying, oh, maybe we should refer you to a gyno. We want that to be happening a lot earlier on, because we don't want patients to be suffering in pain and having a constitution of symptoms. We don't want patients to live like that. So we want them seen early. And unfortunately, it'd be really great if you end up getting an appointment to a gyno. We have a lot of problems with people actually keeping the appointment at the moment. So lots of places I've worked, we have lots of patients who don't turn up to their appointments, which is really frustrating for people who are on waiting lists. So there's lots of barriers. So there's lots of issues. I'm just talking about like a tiny bit. There's obviously country medicine versus city medicine, cost and availability of doctors, free services versus private sector. There's a lot of barriers for an individual person who's probably quite young, doesn't have enough money to see a specialist, probably doesn't have private healthcare, just to get in to see a doctor. It's quite sad, to be honest.
Yeah, it can be quite sad. Like, it's hard to not take that on and feel really negatively about it, but switching it up and thinking, well, what can we do? But they are real things that are occurring. And I guess on the line with some of those barriers, I know you did mention them, but in addition to that, there is also additional barriers that I'm sure people who are our First Nations peoples also face. And then If you already mentioned living rurally, that's city versus country medicine. And then I'd also like to bring you in, Egg, as well, about being part of the LGBTQIA community, barriers to care there as well. So Matt, start with you, Mikayla, and then.
So First Nations people unfortunately suffer quite disparity in their health in terms of lots of different areas of health. There's obviously Aboriginal people all in Australia, so in the country, in the city, in regional areas, but there's still barriers, unfortunately, that are specific to Indigenous peoples, like trust in the healthcare system, trust in the doctor that they're going to see. It's, taught in, my mum's generation and my grandma's generation that a man should never see your female private parts. So access to a female doctor is difficult. It's like only my boss's generation that more than 50% of the doctors were male and only around 10% were female. So there was, it's still an evolving workplace where more people that identify as women are available to see our patients. There's distrust in the healthcare system. There's obviously cost and finances, transport to the appointments, waiting times to be seen. There's a lot of issues. And then obviously
there's a lot of work to be done.
Yeah, there's a lot of work to be done. And that's why I try and speak about it on my podcast and on my Instagram, to try and get people in early and get people seen for their symptoms early, so that they're not living with debilitating illnesses for a long time, which we know that Indigenous people are late to present.
Yeah, and I think the work you're doing in that space is absolutely phenomenal. And when I release the recording, all of the links to that will be in there, so people can go and check that out as well.
Thank you.
I'll switch over to you now, Egg. What has been your experience of some of the barriers to accessing care?
So the biggest one would be around language. It starts from the very top. Like when we're talking about these kind of sectors, we often use the term women's health, and that's immediately isolating, it's invalidating, makes it really hard to go to appointments, because a lot of gynecologists and obstetricians, their websites, they use very gendered language. I often go in, I have to use my birth name, which is not the name that I use out and about in public. There is no room to talk about my experience of gender, my pronouns, the name I would prefer to use. And there are always these excuses of, well, that's what's on your birth certificate, so we have to use these. I understand that. I understand that there are legalities to do with my name. All I'm asking for is when I'm in an appointment talking about something that is so incredibly personal, that you acknowledge who I am as me, because otherwise I'm not going to want to connect. I'm not going to want to be present for the appointment, and I'm not going to come back. And that has been my experience over and over and over again across the health system, not just in this particular forum. So those are some of the biggest barriers, especially as LGBTQ community, is how we're using the language. And that starts from very, very early on, as when we're talking about puberty and we're talking about when periods start. It is all gendered, and that follows us all the way through. So really the work has to be done much earlier on than to this point, because by this point it's a little bit too late, and we've already done this for 10 plus years of dealing with this kind of language.
Unmuted. Yeah, I think that's a massive barrier to care that you've mentioned, and something that a lot of people wouldn't even second guess, and especially something that I wasn't aware of until a few years ago. And I'd go to appointments and I'd fill forms in and not even give a second thought to circling male or female or anything like that. And that would be a whole experience and challenge in itself. So I don't believe in putting the work back onto people who are living these experiences, but I'd love to know if there are any suggestions or strategies or anything that you would recommend to healthcare practitioners, because I know we have quite a number in the chat, in the panel, not in the panel, but in the audience tonight.
Yeah.
If there's anything you would recommend that they could implement.
Put the boxes down for pronouns, have a conversation with your clients about how you want them to be addressed, put name, like preferred name. It's probably not the best use of term, pronouns. And I understand needing to tick certain biological sex boxes, but also then asking, do you identify as trans? Do you identify as non-binary? What does that look like for you, and how can I support you in that when we're talking about these issues? Like, actually make the time to have this conversation, because whilst it's not necessarily like medically based, it is going to be important to your patient and to their care. They're going to want to trust you. They're going to want to open up. And that's so important when we're talking about a disease that is so debilitating, that takes years to diagnose. And by that point, it has ravaged our bodies. And so this person is going to be in chronic pain for a lot of their life. They need to feel supported and to feel like they have someone in their corner. And that should really be their medical team. Their medical team should be someone that they trust. So that's where I would start. It's so basic. I don't understand why it's not just across the board, but that would be where I would start.
And I think it's quite a simple one to start with, especially if you're having an initial appointment. You can say like, hey, I'm Isabella. I use pronouns she, her. I'm a nurse, so I'll be your nurse today. And then you could lead with, is there a preferred name that you'd prefer that I call you? Do you have pronouns that you prefer to use? And I think like modeling it back could be a great way to implement it. And it's super easy. And I think even changing your form, if you have a paper-based form, that could be a quick change to make, just to make people feel a little bit more included, for sure.
Absolutely.
I really like
and
that.
I know,
Sorry.
No,
I was going to
go.
say, thanks, Egg, for saying that, because it's so tricky. It's not like I want to offend anyone. I don't want to offend anyone. I just want to make it really open, because my goal is to make sure that you are comfortable and that you're happy to talk about your health. And I'm definitely going to use that in my practice every day. Like, I really am grateful for that.
No worries. I'm glad that you liked my suggestion.
No, it's good. It's really helpful because, I want to make sure my patient's comfortable. I would definitely want them to come back, because this is like really important and is terrible. Like, I don't want you to live like in the shadows, suffering alone. Like, definitely not.
There you go. That's a beautiful example of it happening right there. I love to see it. Our next question, and this one's directed to you, Sarah. We know that excision surgery is a key part of endometriosis management. However, we know that that's only one aspect of it, and people can still have pelvic pain even after having successful excision surgery. And I guess this is why having that multidisciplinary or interdisciplinary care is just so crucial when it comes to managing chronic conditions. I would love to know the role of a pelvic physio and how they can be helpful in managing endometriosis.
Yeah, of course. I guess pelvic pain is so diverse, and when we're in pain for a long time, say for example with our cycle, if we're having a flare right before our bleed or a flare at whichever time of the cycle, then generally we might feel crampy, we have aches and pains and whatnot, and that's happening every single month. Then every month you're having this episode or multiple episodes where your muscles are getting short, tight and contracted all the time. And after a long period of time, they just become chronically tight. And as a physio, we look at muscle tension, muscle length, muscle weakness and strength and function of the muscle. And after a period of time, we see a lot of the time with our patients who come in that their glutes get really locked up, their hip flexors do, their core, their pelvic floor, you know, we struggle to let go. And I guess the other side of things is that patients get thrown around to specialty and with no answers. That's stressful, and the body reacts by stress, you know, with tension as well. So it's very, I guess it's really important to look at the musculoskeletal system as well. And particularly in the pelvis, like our bladder health can be severely affected with endo. Whether we have endo in the bladder or not, it can be affected. And likewise with our bowel, we look at our patients' bowel history, their bladder history, what their sexual function is like. Are you able to put a tampon in? Can you have intercourse pain-free? Because that area, it's innervated by the same nerves essentially. So if one organ is essentially annoyed, the other one's probably going to be as well. So we try and look horizontally at what the bladder is doing, what the actual pelvic floor muscles are doing, what the bowel is doing, what, you know, higher up is doing in the core and whatnot. So I think we try and address not just muscle tightness, because that's only one part of it. And we know that doing just stretches probably isn't going to help in the long term with our pain. It might do temporarily, but it's not going to be the be all and end all. We want to normalize our bladder and bowel function. That's, you know, really, really important. And I guess we look at helping patients manage their flares and what to do if you know a flare is coming, or if you don't know a flare is coming, you know, what to look out for and what your pattern of pain is. And that's why the apps are so brilliant, because you can document everything and you can see what the pattern's like. And that way, when you go to your physio, that we can ask you, okay, in the last month, what have your symptoms been like? And so you can compare month to month, and we can sort of see what has worked for you, what hasn't worked for you. Because with endo and adeno and any chronic pain, everyone is so different. And I think the frustrating thing is that people get told, you know, the pain's in their head. And whilst that's not completely incorrect, you know, if we have pain for a long period of time, the brain will change how it sees pain. So the pain's still very real. It's just the way the brain perceives pain. It's more of a threat now, where, you know, years ago when you haven't had these flares, then the pain, you know, you'd acknowledge it and you'd move on. But now when it happens over and over again, that the brain will just change how it sees it. And so it will go into a guarding, protective mode. Your pelvic floor muscles get tight, and like I said, your core and your glutes and everything gets really tight. So if we can work on strengthening and lengthening and working on the pain management side of things, that can make a big difference. But like everyone's saying, you know, it's not the be all and end all with just physio. Like you need a good psych, you need a good GP, you need a good acupuncturist. And again, those things may or may not help you, but it's finding your people and finding what works best for you. And I think that's a really important part of your journey.
Did it again. I'm muted again. I'm too keen to talk. I could not agree more. And I think physios and obgyns are really nicely aligned, and they refer really nicely to each other, because it isn't just that surgery. And again, it's not just physio, it's also seeing the psych, having a really good GP, as you mentioned, and finding what works for you, because what works for someone isn't going to work for somebody else. But I personally have had such a great relief from pelvic physio, and I do recommend people to go and see a pelvic physio, because they are the angels. But yeah, I know one question that came through when I had a question box up the other day was more to do with vaginismus associated with endo. And if you could talk a little bit about how you sort of manage that, and with the internal examination and things like that, is that a necessity to seeing a pelvic physio? Because I know a lot of people can feel quite apprehensive about that.
Yeah, absolutely. So the internal vaginal exam, it's scary. Like, who wants to go and get their vagina assessed internally? It's not a pleasant thing to go and get done, but it is important, but not straight away. The first time you'll see a pelvic floor physio, you'll be there for at least minimum an hour, and you'll probably be talking for the first 40 to 45 minutes. And we'll go through your entire history. Like I said, your pain history, your general medical history, your gynae history, if you have any obstetric history, medications that you're on, what makes your pain worse, better, bladder health, bowel health, everything in between. What do you do for exercise? What works? What doesn't work? And then from there, I guess our jobs as clinicians is to read our patients and know if we can see our patient in front of us is so scared or just worried about the internal exam, we will talk about why it might be needed, but we will never ever push. And that's something, particularly with vaginismus, it can be painful. It shouldn't be painful though. If you're seeing a pelvic health physio and you have the internal exam done and it's painful, it really shouldn't be. And it's usually done very, very, very slowly. Consent is asked every 5 seconds. It has to be, because consent can be withdrawn at any time. And we would never do it if we can see our patient is not comfortable. And I guess the reason we do them as well, we want to educate patients on why we do them, because we're not just going to say, right on the bed, here we go. It does not work that way. And it's not, looking after our patients in the correct way. I think we want to look at, what is your resting tone? Can we actually, if we separate the labia when you're lying on the bed, and can we say, can you squeeze pelvic floor? Can we actually see any movement at the introitus, the entrance of the vagina there? Can it actually inwardly retract? And then when you relax it, can it actually relax off, or are you staying on the whole time? And that already, without even touching, that tells us quite a lot in terms of what is your function looking like from the external aspect. And then, we get you to bear down, like you could be pushing out a big poo, and we'll see how much is your perineum, that space between your vagina and anus, actually moving. That spot there should actually give a little bit when you push down, strain. It shouldn't be rock hard, and it shouldn't be moving too much. So even by looking at things like that, and even the measurements of how open the vagina entrance is and what the width is like and whatnot, that can tell us a lot without even doing any internal or touch or palpation or whatnot. So I guess that's the first part of it. And then from there, if the patient is feeling okay and their pains an absolute no more than 1 out of 10, then we might try a single digit at the very entrance there, and we just see, is it painful, is it not? We gently touch around the labia, and we just look for pain points. And the whole point is, if we touch a spot and it's painful, we stop, and we make it very clear to patients that if you have any pain, we will stop straight away. We won't push into that pain, just to make sure patients are in control, because patients, they know what their pain is like, and they know what can cause a flare. So really important to make sure, if you're going to flare by having an internal exam done, I would highly recommend you to say no if you need to, because we don't know that. We don't know if one finger might make you flare. We're going to go as gentle as possible, but everyone's presentation is so different. But I guess with vaginismus, it's part of the superficial pelvic floor muscle. So we have our superficial layer on the very entrance, and then our deep layer, which sort of lifts up your organs when you squeeze pelvic floor. Vaginismus is very commonly the front layer, that's sort of that very entrance muscle there, where it's just on, and it just will not relax. And that can be caused by various different things. Stress can be a big one, endo can be a big one, chronic pain can be a big one. A history of trauma down there can be a really big one as well. And again, language can be a big one too. Even if sex is painful for you, then by even hearing the word sex, you could even involuntarily be contracting your pelvic floor without even knowing. So that's really important to acknowledge as well. But we actually want to reduce that resting tone, because you'll find that the muscle is just guarded, and we want to teach patients how to let go and how to get back control of that pelvic floor and learn to actually contract, but be able to relax as well. So vaginismus, we can do lots of down training work. We can do internal, release work if needed, gently. We can use dilators, but obviously there's no one size fits all. It's very individual. And sometimes we can get through, 4 or 5 consults and not do any internal work. And the patients, can come back with having a bit of pain relief because they've just been educated. So it's not always imperative, is what I'm trying to say. It is really important, I guess, down the track, but not always straight away. So it should never be forced upon, and it should always be explained what you're doing the entire time.
Yeah, I thank you so much for explaining that. And I think that would relieve a lot of anxieties that people would probably be feeling. And I think Mikayla would probably also agree, when you're seeing an obstetrician or gynecologist, it's the same sort of process around consent and not feeling pressured and saying no as well.
Yeah, I hope that all my patients and patients that see doctors should feel comfortable to say no, especially if they don't want to see a doctor for whatever reason, and maybe you just don't get along, you feel like you're not being heard. Why would you then say yes to a very personal part of your body being looked at and examined? No, I hope you have the courage to say no. I've never had a patient say no to me, but I would hope that if they felt like today was not the day, then they would say it. Because I personally, I don't have any like feelings towards it. I just feel like I would like to find out why and how we can get across those steps, because unfortunately at some point we will have to do an examination to see what's going on for you. But
no.
It's such a vulnerable state. I remember this one time when I went to see a gynecologist and I looked them up online, and they had all these like really unattractive photos. And when I got there, it was a male model. And I was like, oh no. But he was an amazing doctor. And I said yes to an examination, and it was completely fine. He was amazing. But you definitely have a moment where you're like, this is very invasive and this is my private parts, and I only let some people see it who I choose. So it's very important to make sure that the person that you're seeing you're comfortable with.
Oh, definitely. Thank you so much, Sarah and Mikayla. I really appreciate that. Now, Sarah mentioned about the importance of using apps to track symptoms and pain, and as we've mentioned at the top of this panel, that Devil, you're the CEO and director of the Friendo App. Can you talk about how the Friendo App came to be and what it does to help people living with chronic pain? I know that you mentioned it briefly when you were introing yourself about what it sort of does around the diagnostic screening and things like that. But yeah, I would love if you could deep dive into how this piece of technology has just sort of changed the game.
Yeah, sure. Happy to. So as I briefly mentioned, I guess it was born out of of my own personal distress, I guess, and frustration, and excuse me. And so I think it was after I had all my surgeries. I was diagnosed after 18 years in Australia, and I had my last surgery there, and I guess I felt that's it now. I'd had 3 and I was getting barely 6 months relief out of them. And I decided, no, I have to kind of change my management of myself in order to try and help myself. And at the same time, I realized, how alone I felt. And there are lots of like Facebook forums and all of this, but I felt they were all full of negativity. And I guess the mission for Friendo is to try and everyone's allowed to share their story, but the objective is always to kind of find a solution. And so that's why we did a lot of research around what people actually wanted to get from it, and the most that what they really want is to track their pain, like to actually find out, but not just track. But what we do is it pushes back insight. So the more data you put in, the insights it pushes back. So last month you took your medication 2 days before ovulation, or you had acupuncture on this day and that really helped your pain. And for me, that's kind of always what I was looking for. It wasn't just like, here, suppress it with medication. It was like, okay, well, how do I manage this on an ongoing basis? And it is a chronic illness. So, you know, if you're finding physio is really good, well, then you track that and alongside other areas of your well-being. And the bigger picture kind of conversations we're having now are around doing more research. And I think across the board, you know, like there is such a lack of research, you know, for non-binary people, for women, for like, and that is the major issue. You know, that is, we are so underrepresented. And I guess what we want to do is actually use the information and the data and in order to actually create something that is of use and better treatments. And so really the tracker, I guess, is the most, well, I think the most important part. But the screening survey also was crucial, because for so long I had nowhere to go. You know, I was the daughter of a doctor. I was one of the lucky ones, but I still felt so alone. And what I want from that is those people who have suspected symptoms, that they at least have, it doesn't diagnose, and we don't claim to diagnose, but they can go somewhere and at least, you know, feel validated in a way. Okay, so you have medium likelihood of having endometriosis. And what they then can do is export that, take that to a GP. And what we find is, and, you know, Dr. Mikayla and a lot of the panelists have spoken today about, like, it's crucial that, like, the medical profession need to take on more education. They need, it's not our job, you know, but I feel being able to hand them this report from Friendo, and we're soon launching a feature that allows you to nominate 5 of your network. And so that is possibly your boyfriend, girlfriend, you know, father, clinician, and they can have access to certain parts of the app. And that, I think, gives them, it reduces when you're in a flare up, the last thing you want to do is constantly be explaining your symptoms and explaining what endo is. So the idea of that is, hey, you can have access to this part of the app, go and educate yourself, but also it freely allows you to sit with a clinician, and instead of like having to remember everything, I'm going to share this with you. This is what I've tracked over the last three months. You know, I have severe symptoms. Now take me seriously, you know, and the feedback that we've gotten from GPs in particular on that is, yeah, if I see that in front of me, I think that, you know, I have to take that seriously. And I'm seeing someone with chronic pelvic pain, they're hemorrhaging, they have sciatic pain all down their leg, they're missing a third of the month, you know, as a result of this pain, minimum. You know, some people miss a lot more. And so I've kind of gone off on a tangent, but I get really frustrated by, you know, the system around it, which is, that brings me back to your question, which is why I developed it. And we recently commissioned an independent survey with 2,000 people in the UK, and, you know, 70% of those were dismissed between up to 4 times. And many of those were also dismissed, you know, between up to 10 times. And that's just not on, you know, like, and I think what we want is that ability to be validated and to be listened to and just to be heard. And that is really the objective, I guess, with Friendo, is this: at the start of your journey, have someone or something that listens to you, read about other stories so you feel less alone, be able to present something tangible to a doctor and say, I have been sick for years and I'm not being taken seriously. And then the next step is feeling part of a community, which is what, you know, Aegon was saying as well. And that's really, really important to, like, reduce that isolation feeling. So yeah, I guess they're the reasons, you know, that it was started. And I think it's a consistent feeling throughout so many sufferers, you know.
Yeah, I think a lot of us have felt that way, if not all of us who are here, even if you don't necessarily have endo, but if you're living with PCOS or fertility issues as well, I think everyone can relate to that feeling of isolation and not being heard. So I completely agree. And I love that you sort of have that information, and it's sort of a more reputable source of information because you've been tracking it, and here's all of this data. Please take me seriously. And it puts the onus back onto that healthcare professional. And you'd hope that seeing all of that raw data there in front of them would, sort of support your cause. Not that you should have to really go in there to fight and battle, but you sometimes do. Really support your cause with like, here's all this evidence that I've presented to you. Please listen to me.
Yeah. With our recent survey, we did find that medical professionals were quite like shocked, and there are really good ones out there, great ones, like a lot of who we're talking to this evening, but there is still a huge journey and a road to come in terms of that education. And it is about, I think, being like that CEO of your own health. Like if you feel like there is something wrong, the likelihood is there is something wrong. So don't let someone dismiss you. And if a tool, or if someone helps you to get that message across, bring it with you to the appointments and keep pushing, until you feel heard.
I was going to ask about like the trends that you've seen relating to endo as a result of the Friendo app. I guess you mentioned one of them with the independent study that you released. However, is there anything else that you've sort of noticed in the back end data collection wise?
Education is a really key part. Sadly, the younger cohort are being really affected, particularly by the mental health effects. And I guess education, only 3% of who we surveyed knew anything about endometriosis in high school. And I think what that links into is the mental health challenges that young people have when they don't know what's going on with their body. They know there's something wrong, but they don't know where to turn to. They're being told heavy periods are just normal. We're conditioned to, accept a certain amount of pain. And so that was for me, the quite astounding, to 63% of those up 18 to 24-year-olds suffered from mental health issues. Now, like that, they're young people, and I think we have to try and tackle that and support that. And I think the trends, we know the 75% of women now use digital tools for their healthcare. And I think even more so after the pandemic and COVID, we're using apps, we're using platforms much more to try and help manage our health. And I think we're only going to see that grow hugely. We, like women and people with periods, are going to take their healthcare into their own hands. And I personally, I do see it is around grassroots education. So getting into schools like as early as possible, because what that does is it gets the diagnosis early, and it and potentially breaks the cycle early. And so that's really key. We're hoping to screen in schools, but also tracking. What people really want to do is they actually want to help themselves. They want to find better ways to manage their chronic illness, because they're not finding it naturally through that, like laterally or holistically from different practitioners. So I do think we're going to see a lot more digital tools, in reproductive health.
Yeah, I think that would be really interesting to see. And I hope that they're integrated successfully and authentically, so they actually can be helpful and useful to patients who need them so desperately. In Australia, we're really lucky to have Pep Talk. So it started in South Australia, and then there was a pilot in Queensland, and then it was able to get funding for Western Australia, and then as of, I think it was the start of this year, it's rolled out nationwide. So that's a periods pain and endometriosis talk for high school students. So that's a really wonderful resource that we're lucky to have here in Australia, except it's just about getting schools to take on that program. It's an hour, but trying to challenge schools around taking an hour of curriculum time can be a challenge in itself. But yeah, so we are really thankful here, but hopefully that you can do something similar in the UK.
Yeah, you guys are so ahead. You are, and that is a really good step. And yeah, I think, and I think what'll come from that is better research as well around girls and people with periods, who are like what age they start suffering, what exacerbates that. And so I think, yeah, that they're really good steps, and we have to acknowledge that and hope for more as well. We're a little while off here.
You will get there, I'm sure of it, especially with the important work that you're doing. I'd love to open the floor up to the people in the audience tonight. If you had any questions, to pop them in the chat now. There was one that came through that I think might be best directed to you, Mikayla, and potentially Sarah as well. Someone's asked about if there's endometriosis that's been diagnosed via laparoscopy and it's on the bladder, but instead of being excised, the endo was left there during surgery. Is it better to seek advice from another gynecologist or endometriosis specialist for removal, or should they see a urologist instead, and or should it be a combined treatment approach from both? And then also, I guess, that bladder impact side of things from a physio perspective.
Yeah, so when you see a gynecologist, some gynecologists specialize in endometriosis surgery more specifically. So it depends on what gynecologist you saw. And I guess the other thing is whether or not it was a large piece of endometriosis, small piece of endometriosis, where it was on the bladder, why they didn't remove it, and what were their concerns. All of those things you can discuss with your doctor, obviously. And then even if it is removed, do you have bladder symptoms? Are they impacting your life? So all these questions I'd ask my doctor and speak to my doctor about.
Mm-hmm.
In terms of having a redo laparoscopy for one piece of endometriosis, I guess the question is, obviously we know endometriosis is a lifelong condition, and managing endometriosis not only surgically based, but medically based and holistically based. We need to think about whether or not we should look down those avenues rather than put yourself at risk of another surgery that comes with risks and benefits, but also mainly risks that we need to think of, especially because you're young and fit, most likely. And if any adverse outcome was to happen, most of the times they are rare, but if something was to happen, they could be quite detrimental to you. So we need to consider all of these things when we think about surgery for all patients, because bad outcomes are very rare, but we do still see them, and we're only human, so we can't expect absolute perfection each time, I guess.
I think that's really important to note, because there isn't anything without risks, and it's weighing up that risk versus benefit. And then, like you said, chatting with your doctor about all of those concerns, and then being guided by their response as to urological involvement as well. Sarah, I know you sort of touched on bladder function before, but is there anything that you'd consider if someone were to have endo on their bladder?
Yeah, I think Dr. Mikayla said it beautifully. Sometimes you can have endo on your bladder and you may have no symptoms at all. And I think thinking and I guess letting that worry you too much about that bit of endo on your bladder you may have the same symptoms if you're going for a repeat laparoscopy. So we don't know if that one piece is going to cause a lot of pain relief, or if it's removed, is that going to, you know, I guess fix a lot of the issues? And a lot of times, unfortunately, a lot of the time it doesn't. And that's why when there's chronic pain is chronic. And if we don't sort of unravel how to deal with reducing that pain and fear cycle, then no matter how many surgeries we have, unfortunately, if there's always going to be chronic pain there, and if we're looking at pain, you know, as a threat to us, then you've got to really think about, is surgery the best option for you? When it comes, I guess, to the bladder function, we want to try and normalize that as best we can. And our bladder can be very behavioral, and you can have overactive bladder symptoms and urgency with or without endo. And, you know, fortunately, we know how to cure those things and really help those symptoms. So I think bladder habits are really important. They're kind of a fun one to treat because it's very behavioral, and how many times do we go to the bathroom just in case, you know, because we're so used to it. And we might think that emptying our bladder all the time might give us less pain or symptoms, but we could be actually feeding into that dysfunction rather than finding a solution. So I think having a big chat to your physio and talking about how much water do you consume, how much fluid do you consume, how often do you do a wee during the day and night, and how much output is there, and, you know, do you have a dribble after you wipe? There's so many parts to your bladder function that we look at, and I think, yeah, we want to look at the whole picture. It's really complex, the bladder and the bowel and the pelvis.
It is, isn't it? Another question that's come through is about, during a surgery, they found an infection that looked like a spider web that had pulled my endometriosis together and my intestines. Is this a form of endo? My endocrinologist said it wasn't. They tested for various diseases or HIV, nothing came back. So I never actually got an answer for what the infection was, and I've not been able to get any answers. I'm not sure what sort of specialist to see. So not sure if you can shed any light on that at all, Mikayla. I'm sure I already know what your answer could be.
It just depends what these spidery type things look like. Like, there's so many things that can happen in the body that can look like something. We send it away for diagnosis and comes back as nothing. And we're like, okay, well, that's not helpful at all. And for most of the time, we don't find the answer. We are a weird human body. Like, we have so many different processes inside of us that can look like so many different things that we may never get an answer for, which is so unsatisfying. And so I guess in some ways we just have to be happy that it's not something serious. Like, imagine if you were diagnosed with HIV, that would be a terrible outcome. And just, I guess, accept that we may not know.
Yeah, I completely agree. And I think, like, it coming back as nothing, sinister is a good outcome, but I completely understand that it can be frustrating not knowing. If you happen to have any pictures from surgery, you could go and get a second opinion from somebody else. They might know, but yeah,
it's really hard to say without being the surgeon on the day.
Yes.
And there's so many different things that could be what look like a spider web without being the person there. It'd be really hard to say.
Completely agree. We've had one more question come through. If any others come through after that, I might just email the people who they're associated to, because I'm just conscious of time. Just about how we can advocate for ourselves if we're not feeling comfortable with a treatment option or a suggested birth control method that has been offered to us to manage our symptoms. So I'm not sure if Mikayla, you've got like a doctor's opinion, and maybe Devil and Egg, you might have like a patient perspective on that as well.
I absolutely love the idea of the Friendo app, because as a doctor, you obviously have so many questions about symptoms, and the patient who's suffering through all of these symptoms obviously has a lot on their mind, and this just gives them so much more like validated information that can then have the input of like, I've had this medication on this day and my symptoms are still like this. Obviously, we're going to read that and take that as really quantitative information and say, well, we're not obviously winning. We need to do something else. And I really like that it gives us some like solid information that we can work on, because when you're at the doctor's, you have like 15 minutes to get all of your story out really quickly and then have a examination and a diagnosis within a short period of time. Whereas this just gives you like a quick summary. I really think that's going to be really helpful for a lot of practitioners, because it gives us a summary that's so easy to use. I really like it.
Thank you for that perspective. I'm not sure who wants to jump in next with a comment.
I was going to say, if you are not comfortable with the treatment plan, if you're not comfortable with the person, just walk away. At the end of the day, you need to feel the most comfortable. I know from personal experience within my family, my mother had a gut feeling about her obstetrician when she was pregnant with my older brother, her first child, and she didn't listen to it. And he is now disabled, and that was because of medical negligence. And she has them very firmly taught me and my brothers that we need to feel the most comfortable in most spaces, but especially in medical spaces. So it could be the smallest thing that you could feel like. If you are seeing red flags, if you are seeing pink flags, feel free to walk away, to get a second opinion, to go, that's interesting, I'm going to take some time to think about it. Like, you do not have to make a decision then and there. You do not have to go with this person, even if it's the person that, you know, is the best endo specialist in the nation or in the world. Just because they're considered the best doesn't mean they're going to be the best for you. So recognize that what you need is of the utmost importance, and it can take a lot. It's really hard to be, you know, that affirmative and decide to walk out of a clinician's door and say, no, I get that. But recognize that, you know, you are the most important person in that room, in that moment. And so listen to your gut instincts, because most of the time they're right.
That's so powerful. Like Girdle said, that we're the CEO in our own health. So I love that perspective. Do you have any strategies or perspectives to add to that, Girdle?
Yeah, I would say, I think across the board, definitely I'm in agreement. It's go with your gut feeling. But I think even before that, I think what empowers us a little bit more is when we prepare. And, you know, and that is because I remember it's like Dr. Mikayla said, you kind of, in such a short period of time, you're getting a diagnosis, you're getting an exam, which is pretty damn traumatic on its own, you know. And I remember just being in there going, I can't even remember what the doctor said to me after I came out. And I always think, oh, I wanted to ask that. And I felt really rushed. And I always felt like I was kind of at their mercy. And I think that I do think that narrative is changing more with, you know, with doctors. But I think if you prepare in terms of whether it's using an app or, you know, like Friendo, or just in your notes, like writing, like what are the symptoms that you have had, but also kind of what made you feel good. And I also, whether it's either that or talk to someone who's been through that, you know, that goes back to the community, and talk to someone who has been on the journey and say, and so that kind of gives you more, it prepares you a little bit more as to what to expect, you know, because I remember, you know, I do remember a couple of examinations that were just excruciatingly painful. And physically and emotionally, I was just kind of gone for the rest of the appointment. So I think if you have your notes prepared in terms of what you want to ask and also what you want to get out of it, at the end of the day, remember, you know, you're paying them, and you know, it is the ideal situation is that it is a partnership and it's a relationship that builds. And it's like Mikayla said, you want them to come back, like they want the patient to come back. So if you feel like you trust them and you're getting your point across and you feel heard, then I think that's the best outcome. But for me anyway, it is about being able to advocate for myself more, is being prepared and explaining all of the symptoms and the feelings that I have around it.
Definitely. And I think, you know, standing true to what you believe in. So if that's something that's a, you know, a no-go for you, and you set that boundary of, I really don't want to have that birth control method, you know, you're well within your right to say, look, I'm really not comfortable with this. How about I'm open to this, 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 and this though. So it's all about being flexible, and I'm sure any good doctor would be more than willing to work in with you.
Of course, we why would we prescribe something the patient didn't want to do? That's terrible practice.
So,
and I hope we're calling out those doctors. That's terrible.
Yes, exactly. That's all the time we have for questions tonight. So if you did have one that I've gotten through all of the ones that were sort of sent through here, but if you leave the chat tonight and you think, oh, I've thought of something, please send through an email to hello@letstalkperiod.com.au, and I'll pass it on to the appropriate panelist for them to answer when they get a moment. Before we leave though, because I am conscious of time, I would love to know if there's anything else you'd like to share tonight, or if there's something you would like to see change within the pelvic health space. So I'll start with you, Mikayla.
Yeah, so I'm actually about to start research on a really interesting and could be a game changer for pelvic pain. I can't really talk too much about it because it's still very new and preliminary work has happened, but it's going to be a research stage. So if you want to follow on Instagram, I'll be sharing all of the information there. But I'm really excited. It's super exciting. I didn't get to tell you the other day at breakfast.
I'm so excited to hear.
I really think that it can help a lot of women and people with vaginas, obviously, because it's so important, chronic pain. And I really think it could be something that changes people's lives. So, yeah, I'm working with my supervisor here in Lismore, and we'll keep you all up to date.
Yeah, definitely. So follow dr.aboriginal.woman to keep updated with all of that. Sarah, is there anything else you'd like to add, or something you'd like to see change within the pelvic health space?
Yeah, I would love to see more funding for women. It's so unfair that patients are out of pocket to see a private allied health practitioner. So I think it might take a bit of time, but I think, you know, it needs to change. It's unfair. It's wrong that we have to fork out, you know, hundreds, if not thousands of dollars to advocate for ourselves and get the care we need. But I think, you know, as long as our patients can keep asking, my biggest piece of advice would be keep asking questions, challenge your health professional. You know, if they're really invested and care about your case, then challenge them, ask them questions of why they're recommending a certain type of modality of treatment or whatnot. Just, you know, never stop being curious.
Oh, that is such a good point. Thank you so much. And Egg, anything that you'd like to add, or something you'd like to see change within the pelvic health space?
The language. As much as this panel has been so great tonight, even the language here tonight hasn't been 100%. I understand it's a learning curve, but it is something that needs to be a top priority amongst funding and amongst research. It has to be about the language. So that is what I really, really want to see. And I want to see better representation as well in these spaces. it's taken so long for me to find fellow queer and trans endo sufferers, because up until recently, all I saw was white cis women, and that is not the be all end all story. There are so many different stories in so many different minority groups that cross over into this space. So language and representation, that is what I want to see.
Oh, there's such great points, and I completely agree. And I love that we got to touch on a way for practitioners to, change their practice even slightly tonight. And that's it. It's all about learning and changing that language and opening the floor up to voices so everybody can get a chance who might have been marginalised previously has a turn to speak. And Derval, finally, is there anything you'd like to add or something you'd like to see change within the pelvic health space?
Yeah, I guess still the focus on younger, like particularly from our research, I think it was, pretty astounding, the effects on younger people. And I think, for us, it is also about allowing our community and our people in our lives to be more educated, which is kind of the point of our squad feature. But it's also on our Instagram page, we do a lot of, how you talk to your employer, how you talk to if you're dating someone new, how you articulate what endo is or how you feel. So I think it is around, let's build that awareness and action around that awareness, particularly for younger people who are clearly suffering as a result of that isolation.
Yes, I think that's a really good point as well. I think all 5 of us I'm going to include myself in there as well, have made some really valid points this evening. And I hope everybody who has joined us tonight has had something to take away, consider and think on. Even just those last 4 perspectives about things that need to change are a great thing to start with, or using pronouns and thinking about being inclusive as well is a great one. So I think they're all really great places to start. Again, if you did have any questions, send through an email. This will be sent through as a recording in the next day or so. So you'll get that one. But yeah, if you want to keep updated with any of our lovely panelists, I will pop everybody's information in the email as well, so you can keep updated with what all of them are doing and all of their incredible advocacy work that they do. So thank you so much to Dr. Mikayla, Derval, Sarah and Aegon for joining me tonight. It has been so wonderful to have you.
Thank you guys. Thanks for setting it up, Isabella. It's brilliant.
You're so welcome. So that concludes our panel this evening, everybody. So I will talk to you all later. Thank you so much.
Bye.
Bye.
Bye.